just tell us through, like, what's the journey of how do a patient prepare for a transplant of the liver?
Yeah, so a liver transplant is typically the best treatment for patients who have underlying liver dysfunction as well as an early stage cancer because it's considered a cure for both of those conditions. It's associated with the best long-term survival that we see for liver cancer, as well as the lowest chance of recurrence long-term. So it's a great procedure for those patients who require this. Now, to your point, this is a major operation. So it's associated with good long-term survival, although it does require a period of recovery after the operation, and can be associated with a risk of complications shortly thereafter. One of the key things is for the patient to undergo a careful evaluation with the transplant team. This requires not only an evaluation of the cancer, their liver function, but also the other medical conditions, the status of their heart, the status of their lungs, their social status to make sure they have enough support. So they will go through multiple appointments to make sure that they will qualify for a transplant and will do well after a transplant because the transplant team is highly invested in them doing well long term. That's why we do this. If they are eligible, then they would be listed for liver transplantation. So they would go on the transplant list. The transplant can then be done via a living donor where somebody they know donates part of their liver to them, or it can be done via deceased donor where they wait for sort of an organ to become available. The nice thing is that a living donor is done in a more expeditious or faster manner, but it does require the patient to have somebody who is healthy and willing to donate part of their liver. If one goes through the deceased donor pathway, which is the most common pathway in the United States, it does take time. So they are typically on the waiting list for 6 to 12 months. And so we treat the cancer while waiting for the liver transplant to happen. These are called bridging therapies. And these can be done using a host of different therapies, including ablation, embolization, where one injects beads with either chemotherapy or radiation therapy directly into the cancer, or systemic therapies, even immunotherapy while waiting for that transplant to occur.